I'd like to thank you all for joining us this afternoon as we have some important updates from the City of Jackson with respect to our COVID-19 response. I thank you for your presence because these are important and critical updates for the constituents, our residents to be aware of as we continue to fight back from this virus. I want to make you aware that the city is expanding the testing by purchasing 6,000 of our own tests, 5,000 of which will be distributed through a partnership with Jackson Hines Comprehensive Health in order to do more testing for residents that are in need. 1,000 of those tests will be, an additional 1,000 tests will be utilized to prioritize first responders and inmates at the Hines County Jail. We will be entering into an interlocal agreement in order to assure that the inmate population can be tested because that is a very vulnerable population based on the close confines in which they live. Hazard pay. We will be issuing hazard pay to first responders. This is a population amongst us that not only run in the line of danger in order to protect us at all times, but at a critical moment like this. We are well aware that not only have we had unfortunate circumstances of some of our first responders contracting the virus, nationwide, this population has been disproportionately affected by the virus based on them dealing with people with a high suspicion or a high suspicion of having the virus. And so we think that it is important that we provide hazard pay to them, and this will be issued in a check before the end of this month. We have also entered into an agreement with one of our hospitality partners, a local hotel, in order to provide rooms for those that are in need of isolation or shelter, or quarantine is a better word, based on having contracted the virus and their concern over passing the virus to loved ones, or if they are unable to have shelter on their own. This is a service that we are providing as a city for those individuals. We have also purchased, as a city, a symptom tracker. This symptom tracker will allow us to better coordinate our response to those that are infected with the virus. We are providing a hotline that residents can call if they believe that they are experiencing some of the symptoms of COVID-19. Those symptoms include a fever, a dry cough, and also shortness of breath. If you are experiencing those symptoms or believe that you may have contracted the virus, please go to the city website and click on the tab for Fight Together, Stand Apart. That is the name of our program as a city that we have branded in our complete response to COVID-19. And so we're asking people to take part in the symptom tracker and allowing us to collect this data. In collecting this data, we will be able to identify hotspots on a map in our city and coordinate efforts, relief efforts to those areas and those communities that may have a disproportionate rate of infection in their communities. This data will be protected. We will be working with medical professionals to assure that no HIPAA rights are violated, and there is a script that maintains that level of discretion that we ask that all of those who are taking the calls abide by. Additionally, we are asking that residents wear masks. I have my mask that I will be putting on shortly after this press conference. It is very difficult to hold a press conference while wearing a mask, but that has been recommended by CDC, and it is recommended because this is considered one of the most critical weeks in the nationwide fight against COVID-19. We are expected that this may be the week that we may hit the highest number of cases, and that we may hit the peak in the nation. And so we're asking people to wear those masks. There are businesses that are open for essential purposes, but we ask that you choose not to go to those businesses unless it is absolutely critical, unless you have an absolute need to do so. I want to reassert and state once again that this virus is serious. For many who do not have underlying health conditions, yes, the rate of getting over the virus and coming back to full health is a very good rate. However, there are those among us who do have underlying health conditions, and those who are above age or elders that are suffering disproportionately to this effect. We are collecting this data so that we can better respond and that we can help the nation better respond based on the information that we are gathering. I ask that you continue to wash your hands for 20 seconds, that you continue to use hand sanitizer, that you continue to follow the hygienic recommendations that we have provided, that if you cough or sneeze, please do so in a napkin and throw that napkin away. We are asking that you continue to maintain your social distancing when you are in public space that you have to go into. And the stay-at-home order is still in full effect. There have been some violators, and there have been citations that have been issued based on those violations. We are taking this very seriously, and we will most especially be vigilant during this week, as we know that this is a critical week in the fight for COVID-19. Lastly, I would like to ask our residents, those who may be traveling through the city of Jackson on Friday at 12 noon, to either put a sign in your window in support of our first responders, in support of all of the healthcare personnel and experts that are fighting on our behalf, in order to assure that we have people who are taken care of, in order to assure that we have the best response possible to this COVID-19 pandemic. We are also asking that if you are traveling in a vehicle at 12 noon, once again, at 12 noon this Friday, we are asking that you honk your horns in support of all of the first responders and healthcare officials that are aiding as we deal with this pandemic, both here in Jackson and nationwide. We have provided you with a number of updates, and so if you have any questions with respect to the things that I have shared with you or anything else that is associated with COVID-19 coronavirus, we will accept those questions at this time.
Mr. Mayor, has the city received those tests, 6,000 tests, and how soon will the testing first responders, firefighters, and police?
We will be testing them as soon as we get them. We have purchased them. They are en route. We were told that we should expect them by Friday of this week, and that is coordinating our response along with our partnership with Jackson Hines Comprehensive Health. There was a need for them to acquire more protective gear, and so this timing is allowing both their ability to get more protective gear in order to administer the test, and at the same time the city provide them with more tests to facilitate our program.
Mr. Mayor, there has been...
Can you speak up for me? It's a little difficult.
There has been a call and concern. Residents are wondering if there could be a curfew during the COVID-19 because of the recent violence. Can you address that?
Yes. Well, we have spoken often about the potential of implementing a curfew. The reality is that a curfew merely puts a timestamp on the provisions and the policy that we've already implemented. The curfew would not change your ability to leave for essential purposes any more than a stay-at-home order does. And so we just ask that people actually abide by those policies that are already implemented. Now, if it makes it or spells it out any clearer for individuals, then potentially we will issue a curfew. But the curfew does not change what is already in effect. You are already told to stay at home unless you have an essential purpose for which you should leave. And the curfew would just put a timeline on that where that is already the case. And so that it essentially changes nothing. It just gives a time by which people recognize that takes place. And so the stay-at-home order makes it very clear that you are not supposed to leave the house unless you have that essential purpose or need. Any other questions?
Mayor, you talked about the hazard pay for fire accident folks. They now have what they need,
Yes, we have issued gloves and masks to our first responders. In fact, we are maintaining a spreadsheet of what has been issued to which precinct, what department, and even to what first responder. And so that's critical for us. Now, what we are dealing with is a shortage nationwide in terms of personal protective gear. And so there have been guidelines established by the CDC in order to maintain the personal protective gear that you are utilizing, like masks, how you can disinfect that mask, hang it up in order to use again. And it's not simply an equation or a question, rather, about purchasing more protective gear. It's a matter of supply chain and demand. And so because we are having supply chain and demand issues worldwide, we are requiring and we are in need of following those guidelines because there's no certainty when more protective gear will be available to the city of Jackson, the state of Mississippi, or any municipality for that matter. And so that is why it is critically important that we follow those guidelines in order to reuse these masks until we have a larger stockpile.
Mr. Mayor, can you identify the hotels that will be offering the services for first responders?
No, I will not identify those hotels for HIPAA reasons. I don't want a stigma placed on those individuals who are seeking safe harbor while they get better. But I will let you know that we have reached an agreement with one of our hospitality partners in order to establish such a place for people to rest and get better. People can call the hotline, which we can provide to you if they want to get there. I already understand that you already have the hotline, and you can go on the website for that. I don't have the number here in my notes, and so that's why I won't say it over the microphone. But I ask that people, and we will make certain that we promote that hotline well for them, but I ask that people do go to that hotline if you are experiencing the symptoms. If you are indeed in need of going to this hotel in order to get better and to take your family out of risk, or whomever you may be living with, out of risk from contracting the virus. You had another question? Yes, I spoke with the police chief about that shooting. It is my understanding that they have a person of interest that they are questioning at this time. The investigation is not complete, and I will shy away from providing more details until I have the opportunity to talk with the family. I can't hear you.
Just a word to the city residents after this.
Yes. Well, it's an act of senseless violence, and there is no justification for it. And so we will continue to be vigilant towards it. I continue to assure the residents that we will do all that we can to bring this situation to justice. And we ask that anyone with any information come forward and provide it to us. I ask that you keep the family members in prayer and cover them at this moment in time. Thank you. Any other questions with respect to?
Go live on the full program is this Friday.
Okay. Go live on the full program. We will go live on this full program this Friday. So that is with respect to the ability to get tested more. Once we get the test in, we will have people prepared to answer the calls at that time with the hotline. And so we want you to know that the city of Jackson is being proactive in our response to this virus. Thank you so much. We appreciate your time and we appreciate your questions.